This is Lara Turner for Innovation and Technology Information Access at Brandon University, Innovation Project Video and Proposal. The estimated cost in the United States related to medication adherence is between $100 to $300 billion for the year 2012 alone. Over the course of a year, half of U.S. adults are prescribed at least one medication and 15% are prescribed 5 or more. Studies have shown that adherence for medication in chronic diseases is approximately 50%. This results in increased costs for inpatient care, outpatient care, and access to emergency services, without considering the overall impact for individuals. There are a multitude of factors that influence individual adherence to medications, but complexity of medication regimen is a primary one. Individual health literacy, the relationship between a patient and provider, impairments related to chronic illness, individual cost, the challenges of coordination of care among multiple providers, client belief in the medical plan or technology that is being utilized, and psychological barriers which include intentional and unintentional adherence to medications. There are over 160,000 mobile health apps available in the commercial app stores. Issues such as privacy, accountability, evidence-based practice, and systemic review of quality and content are all needed and required for further study in relation to these apps. However, the World Health Organization has successfully incorporated mobile technology in conjunction with several developing nations or communities to address health services. Key players influenced by mobile technology include healthcare providers, patients, hospital systems, insurance companies, engineers, computer programmers, pharmaceutical companies, federal regulation committees, and the U.S. Food and Drug Administration. It's important to note that many of these apps are considered health apps rather than medical apps, so they do not fall under the U.S. Food and Drug Administration's purview. At-risk populations such as older adults, chronically ill, physically or mentally ill individuals tend to take more medications. This puts them at risk for effects related to those medications, medication interactions, and they are more likely to have medication adherence issues. Medication adherence is related to an increase in overall healthcare cost, lost productivity, affects individual quality of life, contributes to mortality and morbidity. Previous approaches that utilize disease-driven models have proven to be inadequate in addressing barriers to medication compliance. Individual client education, information handout sheets, and even medication boxes have not significantly increased individual clients to medication regimes. The best evidence-based practice recommendations for improved adherence incorporate a multifaceted approach to patient education, adherence, and provider collaboration. The intersection of field, disciplines, or culture can be used to combine existing concepts into new ideas. Johansson, 2016. For this particular project, the collaboration utilized an existing technology and providers within the specialty fields within the healthcare team. The development of the systemic approach utilizing evidence-based practice at the intersection of specialized fields and disciplines allows for the development of new approaches to existing and future challenges to delivery of services within the healthcare field. The American Association of Colleges of Nursing developed 8 essentials of doctoral education for advanced nursing. In this particular instance, the Essential 1, the scientific underpinnings for practice. Essential 2, organizational and systems leadership for quality improvement and systems thinking. Essential 4, information systems technology and patient care technology for the improvement and transformation of healthcare. And System 6, the interprofessional collaboration for improvement of patient and population health outcomes, were all utilized. It's important to note that the majority of the world population now have access to mobile phones, which has impacted both global poverty and the effect of health disparities. The successful incorporation of emergency services, access to medical information, and utilization of telemedicine has had changes of delivery of medical care in many underserviced areas. For this particular project, the author chose Mango Health. It's a mobile phone app which provides a medication calendar with reminders for clients. When a client enters the information for the medication, it discusses that individual medication, reviews drug interaction and food interactions with that medication. It also allows for monitoring of glucose levels, blood pressure, weight, diet, fluid intake, and activity all within one app. So when clients interact with their providers, they can have all of that information at one place. It allows individuals to monitor their medications and the medications of another individual, allowing caregivers to have all the information under one app. It has health information and blog, which is new information each month and allows a historical scrolling of information provided. It provides rewards for continued adherence. When clients continue to mark that they've taken their medication, they can get bonuses, which allows donation of money to charities or even reduced rates on services. It provides reminders for clients when medications are close to running out. So when patients put in the information on their medication, it asks how many pills are in that bottle, and they put that information in. And then when they get close to running out, it reminds them that they need to either refill that prescription, make an appointment with their provider, or that they are almost done with that prescription itself. It applies to all smartphones. It was developed originally in conjunction with an existing health care plan. They wanted their employees to have better health practices, so they developed this app. It is HIT Trust CSF certified, which means the data is HIPAA compliant and protected. So the access to this information or manipulation of this information falls under HIPAA protection. And it was developed collaboratively utilizing engineers, pharmacists, and healthcare providers, so the information is evidence-based and accurate. Barriers to its use are common barriers to most medication adherence tools. Individual cost, such as the cost of the phone or mobile health services. Client health literacy. It is a simplified information, but it still requires at least a 5th grade reading level. Complexity of medication regimen. The more complex and multifaceted a patient's care is, the more potential risk for there being adherence issues or interactions. Poorly integrated plan of care with multiple providers. This is going to require primary care providers and specialists to have buy-in with the utilization and support with the client using it. So it requires agreement among all of those providers that it's a useful tool. Lack of collaboration between client and provider. Just because as a provider you think this would be a useful tool, if you don't have buy-in from the client, it's not a useful tool. Language barriers. It's written in English and the information is provided in English, so if English is a secondary language or not a primary language, it is not going to be a useful tool. Cognitive or physical impairment. It does require navigation and it does require to be able to utilize a smartphone. Individual support systems. I think that this is something that relates to individual compliance across the board for medical care, not just medications. And client comfort with technology. People that are not very comfortable with mobile phones are going to be less likely to want to utilize this. For this particular video, the author utilized collaborators for this innovation project, including Dr. James Vincent, Selden Baker III, pharmacist, and Vernon Razor, paramedic medical technician. This was because in each case, each of these individuals had a significant amount of experience to offer within this field and a different field per perspective. Dr. James Vincent has been an emergency room physician for the last 36 years and actually has experience with the development and utilization of telemedicine. Selden Baker III is a pharmacist that has practiced both in hospital and in community pharmacies, and also has been effective or a decider in education materials and provision of information for clients both in the hospital and within the community setting. And Vernon Razor has been a paramedic for the last 26 years and has operated both within the hospital and within the community setting. The author chose these collaborators for this innovation project because in each one of them there's a perspective on a plan of care that is based in a different specialty field, but there's an integration and all on concern about patient understanding and compliance with medication and a different incorporation of concerns. Interestingly enough, the input and insight within this collaboration among multiple providers reflects the information provided within the literature and the concerns voiced within the literature. Some barriers to care and utilization of technology include accessibility and cost of mobile technology. In each one of these providers' cases, they have functioned within communities that are extremely poor and recognize that things like mobile phone applications and mobile services are not always within people's means. One of the things that was acknowledged by all was comfort level of both the provider and client with mobile technology. In this case, all providers have been in the field for an extended period of time and operated before the internet and mobile technology became predominant within healthcare, and verbalized both individual concerns and concerns within clients that are not familiar with this technology, such as difficulty in navigation, poor visibility, and concerns about lack of transparency about who has access to this information. Concerns about the information being misleading, inaccurate, or poor validity of information or treatment were all verbalized within this discussion and collaboration. And concerns about individual or client privacy, potential for fraud, or miscommunication issues in the utilization of mobile technology were all also verbalized. There was a mutual agreement that the continued challenges in developing a holistic and integrated provision to care includes that there are multiple providers with different fields and different approaches to healthcare was mentioned. As both technology and medicine continue to advance, the challenges to delivery of care and solutions will be created at the intersections of ideas, fields of specialty, knowledge, experience, and cultures. E-health is defined by the World Health Organization as the cost-effective and secure use of information and communication technologies in support of health and health-related fields, including healthcare services, health surveillance, health literature, health education, knowledge, and research. E-health is a general term which has four distinct but related components. Mobile health, or mHealth, is the provision of health services information via mobile and wireless technology, which this presentation has discussed. Mobile Health Information Systems, HMIS, is systems that gather, aggregate, analyze, and synthesize data from multiple sources to report on health. They can be utilized for information related to patient records, disease surveillance, human resources, management of commodities, financial management, service delivery, and other data needed for reporting and planning purposes. Telemedicine, which is the provision of healthcare services at a distance. They can be utilized for interprofessional communication, patient communication, and remote consultation. And last, distance learning, or e-learning, the education and training on electronic form for healthcare professionals. Thank you. This is a list of all of the resources referred to in this presentation. If anyone has any questions or request any more information, please let me know. I would be happy to provide them for you.